A surgical technologist is a vital part of the surgical team. Surgeries move really quick, so you're going to be setting up for the procedure, operating, assisting. You're standing right by the surgeon during the procedure, passing the instruments, and ideally with anything that the surgeon might need, you are there to assist. You're not going to be sitting behind a desk doing paperwork or charting, which is the majority of the work that a nurse in the operating room does. 99% of your job will be scrubbed in, working side by side with that surgeon. Before the surgical procedure, a surgical technologist is responsible for setting up the room, making sure all the instruments are there that the surgeon could need, making sure your equipment and your furniture is working and available, and so that there are no hitches or hiccups. During surgery, the surgical technologist assists the surgeon. They pass the instruments, pass the supplies, help suture, help prevent blood loss, and ideally the goal of the surgical technologist is to prevent a surgical site infection. As a surgical technologist, it is your job to know what instrument is used where, how, and why. Each instrument is designed in a way that it's utilized for a specific tissue in the body, a specific organ, or a specific use. After the procedure, surgical technologists, they help the patient recover by standing with the anesthesiologist and with the nurse to make sure that there are no complications while the patient regains consciousness. You're also going to be required to clean up and prepare for your next procedure. So a lot of our students, again, they're hired right out of their clinicals. So they are ready to go into these more in-depth, more specialized procedures because of the experience they get within our clinicals. Students are in their clinicals their last 3 semesters of the program. And so during any of that time, the majority of them get offered a job. Being a surgical technologist is very rewarding. If you are working on a patient, you know when they're out of here, you have done what you could do to make sure the patient's life is better. It's an instant reward.